Good morning. This is Erin with the Department of Medicaid. It is not quite 11 o'clock and we are still clearing out the waiting room, so we'll give it just a minute. Okay, good morning. The waiting room is cleared and it is 11 o'clock if you guys would like to go ahead and get started. Excuse me.
Good morning. Glad everybody could make it. Let's see. We'll just go ahead and start out with introductions. I'm Anlin Purden with Hazelwood Home Health.
Susan Stewart with Appalachian Regional Healthcare.
Evan Reinhardt with the Kentucky Home Care Association.
And I believe Todas is on it, isn't he?
I see a box with his name. I don't see his camera on. Maybe he stepped away briefly.
Good morning, ladies. Sorry, I apologize.
No worries.
Ernie. All righty. So I believe we have a quorum. And we'll start out with the approval of the December 19th, 2023 minutes, if there's a motion.
I'll make that motion.
I second that.
All in favor?
Aye.
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 All right. Old business. I believe most of these are, other than the EVV updates, which is everybody. So, Evan, if you want, do you want me to go over them?
Either way, I'm fine to run through them. Yeah,
Okay.
just
Okay, go ahead.
Just looking for an update on where things stand on EVV. I know we're, over a month into the launch now, so just wanted to see if there's anything from DMS's side to, that we can relay to providers or, vice versa, just in terms of how things are going out there.
I think so. This is Pam, and it looks like we've been very happy so far with how it's went and how the providers have been doing. We are working on the first version of a kind of like a report card that'll go out to the provider so that you all know individually, what your visits look like, what the claims, since we've got that that edit in to let you know what it looks like claims, the percentage that would have been denied. We have had a couple providers that have had issues that we've been working with individually through them. It's kind of been varied things. It's been some connectivity. It's been some, I know there's a claims, something with diagnosis, I think that we're looking at on claims. But overall, I've been very excited with the adoption rate and how, we've had several providers that just jumped right in and are doing well. And we're seeing a great mix of both MCO visits and fee-for-service visits.
Awesome.
I have a question. Pam, were you all
Yes.
able to get to the 50% threshold at the end of January?
We are looking at that right now. So I don't have I don't have an answer. I don't know that all providers were there. So we will evaluate, I'm in constant evaluation before we turn on, the hard edits. But we did have some providers that were delayed in getting started, but they were very good in communicating with us on where they were and on what the plans were. So we're looking at that. But we did have some providers that were close to 100%.
Great.
Visit. So I think we've seen just a overall great effort. Even individuals that didn't quite get there, there's been a lot of communication, and that's all that, we've asked for, is just that open communication so that we can help through any issues. And I know the therapy team has been out there and available to help with questions as well.
I know we are one of those providers that is keeping you all abreast of our progress.
Exactly. Yes, you are.
and we're thankful for that. We are live now in 100% live in one location. Just working with our IT team to get the rest of our devices deployed, and how that works is our barrier now. But we've seen very good success in monitoring what we're putting in and what's making it to the aggregator. And as much as we give you guys a hard time, I do want to give you kudos. Working with the state and Therap has been much better than trying to work with the state of West Virginia, which has been non-responsive. So kudos to you all for being great to work with.
We try. We really want to be partners out there, and I will say that we've seen the typical things of people forgetting to clock out or forgetting to clock in. It's brand new. It's going to happen. It's going to happen even when it's not brand new, because we're human beings that are using these things. And so that's why we have, the mechanisms that we can fix those things. But overall, I've been very excited, and I've been excited about the level of, and hope that you all are as well, the information that's available on your dashboards. As you start to use that, there's a lot out there that you all can see as well, that I think will give you all valuable information.
Excellent. That's good to hear, because I know other states, we're hearing about upwards of $500,000 of issues for providers in terms of claims. So glad to hear we're making progress for sure. And thanks for all the help from the DMS side, Pam. We appreciate it.
Thank you. That's what we're here for.
All right. I think the next one might be you too, Pam, on the incontinence supplies.
Yes. So as you know, we did expand the DME fee schedule to include incontinence supplies. That really is an additional supplement in, because I think there was always some crossover from some of the other supplies, right? That's on the home health fee schedule and the DME fee schedule. We're currently working with the healthcare, I'll get their name wrong, our policy division, and looking at, at the fee schedule amounts, making sure, things are consistent, and looking at, I believe we've added a couple things recently too, Evan. It took us a little while to get there, but we did get those, a couple things added to the fee schedule. So we're looking at that, but and it's still really hard to, in some areas, to be able for individuals to get incontinence supplies. So if you all have any ideas of ways to make that better, I am all ears to that. But, I think we're just continuing to look at that, looking at consistency among the different fee schedules when it shows up on more than one, and looking at access issues as they come up.
Yeah, we're happy to. We'll talk internally and see if we can get some feedback your way on getting the net cast a little wider.
Okay, thank you.
I have a question. Did
Okay.
we get an answer on if the person is actually a home health patient, if we need to continue to provide them the incontinence supplies while they're under a visit off with us? Or can they continue, like if they're with the DME, to get their incontinence supplies with the DME and then us provide the visits?
They can do either or. So
Okay.
yes, so they can continue, like if they were already set up with the DME company and we're getting those supplies, they can continue to receive them through the DME company. Or if you all are seeing them and you all had been providing them, you all can continue to provide them. It really is what is person-centered and is easiest for the individual and won't have, a service interruption. And we're also looking at some of the auth requirements around, I'm looking at auth requirements around incontinence supplies. And I'll just tell you, I'm transparent. I've always committed to y'all to being transparent. I really think that if someone has a diagnosis of incontinence, that they deserve to be able to have incontinence supplies and not have to jump through hoops to get them. So we're looking at that and trying to smooth out some of those some of those things so that it's not necessarily that you need to have an authorization to have a certain quantity of those supplies a month, and looking at only if it's over. And I think that mirrors what's on the DME fee schedule right now, that there's like a certain quantity that they can provide per month without having to have an authorization, and it's only if it goes over that amount that an authorization would be required.
Anything else on that one, Anlin?
Nope, I think that was my only question.
And then these next two, I think, are yours for
I
the
believe so.
the overlaps in credentialing.
The overlap that we encountered was actually on incontinence supplies. So we had been providing incontinence supplies to a patient for many years, and she called me one day and said that we had sent her all the wrong supplies. And when I started looking, it wasn't supplies we had sent. So actually, it was a huge confusion. I had to send somebody out to her house to look at all of her paperwork, and they had come from another home health. So when I called them, they said they had gotten a referral from her waiver case manager, and they said they had an authorization as well. So
And I think, Anlin, that's the example that you sent back to me,
yeah.
I think. And so I'm looking into that, into the ASCET system and talking to CareWise to see what happens. So while we don't want them to, so what I don't want to happen is if, because we do have some agencies that are not providing supplies. So I don't, at one point in time, there was a rule that, you had to get both from the same agency, that you couldn't have two separate plans of care, which is problematic if you have one person that maybe is providing supplies and somebody else that's not. But we also don't want overlap. So I'm looking into that. I'll owe you back a response on that, but I'm looking into that and talking to CareWise about how that happened, and as well looking at the MMIS, because for that duplicate logic, because we should have had a duplicate kick out against that prior authorization that wouldn't have let that second one go through on the second step of the process. So we're looking into that, and so I'll owe you back on that one.
Well, that one just happened to work out because I hadn't sent her the supplies yet. So the other place I told him, it was like, if you have an off, you can go ahead and bill for it, and then we won't send the supplies. But I just wanted to make you aware that it happened. And then the last one, there's a company, Verisis, I guess, that different Medicaid use to do credentialing. And I think it's actually now worked out. But in credentialing, of course, they want my last site survey, and we're past due. I think 3 years was last October. So we're expecting one any day. And they kept sending me, notice that they couldn't approve it until I sent them a site survey within the last 3 years. And finally, I just sent them an email and was like, I don't know what to tell you. I don't have it, and I don't know when they'll be here. So the last time I called them, they said that they had approved it.
Okay, and I would ask, like, I think Chris may be on from Program Integrity, or if anybody knows on, because
I know
can't really speak to that. But if there's no one on that can speak to that, I can take that. I can take that question back, Anlin. But you feel like it's been worked out for you all now at this point?
Yes, I think they do for the MCOs. Like, I got one for WellCare, and the reason I was talking to them is one was for another company, and then I got another one for WellCare, and I called them, and I was like, I just re-credentialed for another one, and they looked it up, and they said it had been approved, and it was within a time frame, so they would just go ahead and put me in as credentialed for all of them.
Okay.
So Anlin, you're for lack of a better term, accredited when the OIG does your state survey? Yes. You're not accredited by anybody else?
Right.
Okay, that makes sense. And how far behind are they? When were you due?
We were due last October.
Oh, okay.
So we just keep expecting them any day.
Oh, they'll be there.
They'll be here. They'll be here.
I apologize. So. This is Chris from Provider Enrollment, and I apologize. Were you asking about the credentialing aspect of it, that you were getting duplicate requests for that? Did I understand that correctly?
No, the issue is that I haven't had my OIG site survey within 3 years.
Okay. Let me take that back with my branch manager and talk with her and see if I can get an understanding as far as what's going on with that.
Okay.
Did that affect your specific credentialing?
In the end, they finally approved it. They sent me several emails saying that, they couldn't approve it until they had one within the last 3 years. And I just emailed them back and I said, I have no control over OIG, and they're here when they're here. They don't schedule it, they show up. So,
Okay.
but they did eventually
Okay.
say that they just approved it. So,
Okay, and I'm assuming that's due to the unwinding, them just getting everything back on track with that. But I will follow up on that. Thank you.
okay, thank you.
All right. Was that both C and D? On the
Yep.
credentialing side? All right.
Yep.
I don't think we had anything set up for new business, unless anybody has anything to add there. So we can jump down to any updates from the MCOs.
Hey, this is Holly with Kentucky Medicaid. No updates from us.
Thanks, Holly.
Thank you.
Evan, this is Stuart with WellCare. I mean, nothing other than to let you know that one provider that you referred us to indicated that they were having some problems. Our provider relations rep was, reached out to them and actually went to their office either late last week or yesterday. And they've been educated. There's two different issues. One has to do with billing when Medicare member has both Medicare and Medicaid is a dual, and the Medicare billing manual says condition code 12 is what needs to be reported in one of the fields. I think it's 18 through 28, and I understand that they were not reporting 12, maybe another code. And then that they also had an issue, it looks like, where the member ends up being an eligibility change where they go back to Medicaid fee for service, and WellCare did not require an auth for a given service, but Medicaid fee for service does. And so now I think it's denied by Medicaid fee for service. That was the other issue that they were having. I know there's been some eligibility. I've heard that elsewhere as well, like with retro eligibility changes. But that's
understood. Yeah, appreciate you all going down and having the dialogue, and hopefully they're on the same page now.
Yeah. That's all I have.
All right, thank you. Any other MCO updates?
This is Rosa Morales. Nothing for United Healthcare.
Thanks, Rosa.
Thank you.
This is Herb from Humana. Similar to WellCare, just wanted to share just a few things. We also saw obviously retro eligibility issues as well. Just the other things in terms of claims. Number one issue seems to be where providers are accidentally not submitting the correct MPI and or taxonomy. So it's tying back to an invalid Medicaid ID number or an unregistered Medicaid ID number. We're also seeing situations where it's a duplicative claim being billed. And the other one, which is the third highest, which is EOBs, where a member has either commercial insurance for primary or Medicare insurance for primary, and the claim is missing an EOB.
All right, thanks.
Hi, this is Carrie also from Humana Healthy Horizons. I just want to give you an update for 2023. No issues or concerns, but we did have a 97.6% approval rate and a 2.4% denial rate for home health services. And our top services that were requested denials continue to be skilled nursing for private duty nursing and home infusions.
Thanks, Carrie. Any other updates to share? All right. right, we'll jump down. Any updates from DMS and or Commissioner Lee?
Evan, it's Pam. I don't know that so we're just, as we've talked about, continuing with the EVV. We are starting on the waiver side, starting to the quality reviews and, any certification reviews that we do for the waiver provider. So that's up and coming, but it's something that had been in place prior, but, with the pandemic and just with where we were, things had taken a pause. So all of that is beginning to restart. If anybody has any questions, they can reach out to me. But overall, just wanted to say thank you to everyone for their patience with EVV and all the work with EVV. Like I said, I've been very happy with our adoption rate and how smooth the process has went.
Awesome.
And I don't know if Commissioner Lee was able to join us or not. I know we have several competing meetings today, so.
Gotcha.
I don't think she's with us today, Pam.
All right, we don't have any recommendations this time around, so
And
and
if you don't care, I just thought of something kind of old
go for
business.
it. No, please do.
Have you heard anything, everybody that was having issues with the new authorization system? Is it ESET? Is that how you say it? Is that getting better?
I don't know, Anlin. My
Several
team hasn't said anything, so.
I think we've sent a few examples over just related to ESET. And we've been asked to forward everybody, I think, over to Pam to have those addressed. So that's all the update on our side. I don't know if DMS is seeing anything change in terms of the trend on that one.
I think it was a little rocky in the beginning because it was new for everyone. We are seeing things seem to be smoothing out. There are still issues kind of here and there, but as you mentioned, Evan, you've sent a few things to us. We've had staff from Gainwell have looked into those. I know they've reached out to specific providers. So just as those come up, let us know, and we will work through those. I suspect it's a lot like, anything that's new, it's going to be, there's going to be some bumps in the road at the beginning, but we're hoping that, as things smooth out and as we, continue with education on both sides. So that's what I ask. If you have any concerns, as much information as you can provide as possible really helps us target where we need to, if there's re-education that needs to happen, or if there's a process that we need to look at, that helps us get to that point from the start. But I believe they seem to be smoothing out now.
Okay, thank you.
All right. MAC meeting representation. We still have Susan as our representative there. And our next meeting will be on April 9th. And otherwise, that's it for today.
I'll make a motion to adjourn.
I'll second that.
I believe we're adjourned. Thank you,
Thank you,
everybody.
guys.
Thank
Thanks,
you.
everyone.